It's another day with the physicians where your health is our business. It's growth towards the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training of the regular program.
The support system is, now it's beginning to go out there. People are now talking about it, but we don't have much of that support system.
Your eyes are an important part of your health. Most people rely on their eyes to see and make sense of the world around them. But some eye diseases can have little loss of vision. But some eye diseases can lead to vision loss. So it is important to identify and treat eye diseases as early as possible. Although there are some hereditary factors involved, worsening eyesight as we get older isn't always just about chance. In fact, there are many behaviors and habits that can hurt your eyesight as you age. Conversely, there are numerous practices that can help protect your eyesight. And just as it is important to keep your body healthy, you also need to keep your eyes healthy. And just as it is important to keep your body healthy, you also need to keep your eyes healthy. On your regular Health TV talk show, The Physicians, today we'll be discussing healthy eye habits to prevent visual disability. Stay tuned. It's another day with the physicians where your health is our business and will always be our business. My name is Dr. Martina Agbere, your regular anchor on this program. And we'll be discussing healthy eye habits to prevent visual disability. I have with me a guest. She's a consultant ophthalmologist and a professor at the College of Medicine, University of Lagos. We have Professor Adeola Onakoya. Prof, you're welcome to the program.
Thank you very much.
You look really elegant. As usual.
Thank you. Thank you.
So we're talking about healthy eye habits to prevent visual disability. So do you want to just give us an overview, maybe the things about the eyes, why it is normal, then the kind of things that can make it abnormal, the habits that one needs to imbibe to keep the eye healthy?
Well, our eyes, they are very precious to us because, the eye is actually the connection between the brain where processing and everything takes place and the environment. If you don't, if you're blind, for instance, you cannot see what is around you for you to be able to process. So the eye is very, very important. So we need to take good care of it. Now, so what are those habits that we should indulge in to ensure that our eyes last till we go to answer the call of the Lord, or to answer the call of, I don't want to say die. So
natural call.
Natural, yeah. So what are those things that we should do? In my previous topic, talking about children, because it's important to start from early childhood, what we do with our eyes. Now, it's important that we ensure that children's eyes are kept well. How do you keep them well? Make sure that you clean the eyes. You know, mothers, like newborn babies, sometimes they have some discharge occasionally, probably because of the descent through the mother's vagina. During that time, they may have some infection. So for such children, just getting clean water and clean cotton wool to clean it off is adequate. That's a way to keep that eye clean. And you may also, if you can get saline, you know, that is salt plus water. You can just use it, not so much salt, to clean the eye with clean cotton wool. Now, some people would go to the extent of adding sugar. That is unacceptable, because the sugar will feed the bacteria further, and then you're going to have severe infection in the eye, which may lead to blindness, which we call ophthalmia neonatorum. So it's always important that we take good care of the eyes. And if the discharge is more in such children, you take them to see the doctor, who would prescribe the appropriate antibiotics that will be used for such babies. And also, if we notice any abnormality, what does not seem to be right with the eyes of a child, you notice any mark or any spot in the eye of the child, take the child to see the pediatrician, who will then refer to the ophthalmologist. And looking at the eye of a child, the two eyes should move together, okay? And it should be that part of the eye that is transparent should be clear. There should be no spot on it. And there should be no redness. Normally, the eye is not meant to be red. When it is red, it means something is going on. Like if you have a pink eye, it's either there is conjunctivitis or there is some infection. So all that would have to know, so that we don't neglect it, such that it won't lead to other disorders that may end up with blindness. Now, as the child is growing, because ensuring that the eyes receive enough light would also help in the development of vision in the eye of such a child. So if you notice that there is a white spot, for instance, or the eyes are deviated, you must take that child to see the doctor, because you need enough light for visual development to take place in the eye of the child. Now, children of school age, you know, by the time they start reading and writing, healthy habits for them is have good light, very bright light, no dim light. You know, light from lanterns sometimes, if you stay too long, if that is what you do habitually, it may also affect vision eventually. Apart from the fact that the smoke from the lantern can irritate the eye and cause allergic conjunctivitis, you know, it may also cause some watering, and you know, that also can lead to some form of conjunctivitis in the eye. So these are the things. The lighting must be good, not poor lighting. And then the environment, you know, make sure that you don't stay in a dusty environment so you don't develop allergies. And if you know that a child suffers from an allergy, then you have to be careful with the kind of food the child eats, you know, the fragrances that you use around the child, you know, the body cream, the soap that the child uses. Because sometimes a lot of these children, the reason they have allergy is because of the soap they're using. Sometimes they may break out in rashes on the forehead. That may not be there at some other time. But all thing you may notice is the eyes are red, or the child keeps rubbing the eyes. You know, this is because of the allergy. So we have to be careful with all the things that we use for our children. You know, the soap, the food they eat. If you notice that whenever a child eats a particular type of food, you know, he starts itchy, you know, the body scratches the body or rubs the eye, then it means that that child is allergic to it. The best treatment for allergy is withdrawing the allergy.
Identify the
yes,
cause.
Identify and withdraw. You know, if you bring the child, we may give some eye drops that may relieve the child. But the moment the child is exposed to that particular substance, he or she comes down with itching, redness, and if it goes on for a long time, the eye will turn brown instead of being white. That white part of the eye, it becomes brown because of repeated itching, redness, it resolves, redness, it resolves, and then the child now has a brown eye. And later the child will be looking for some eye drops that would lead to a whitening of the eye, which may not really help.
Okay, Prof, as a consultant in a teaching hospital, have you had instances where you have mothers bring their daughters with this eye pencil?
Yes, antimony powder.
Yeah.
Yes, that's
and they tell you it's to drive away evil spirits or something?
Yes, that's what. Sometimes they tell you that it drives away evil spirits, as you have said. All these unacceptable, harmful, traditional practices. You know, the antimony powder is a source of allergy. You know, when they put it in the eyes of some children and the eyes are watery, red, weepy, the interpretation is, oh, all those evil substances in the body, they are coming out. So that is their own interpretation. Whereas it is the reaction of the body, because it's now recognized as an allergen, and the body then reacts with the redness, with the watering, and then the irritation in the eye, and the child keeps rubbing the eye. You know, this is not good enough. And if that antimony powder is actually contaminated, it may lead to bacterial conjunctivitis, which could infect the eye, and if care is not taken, it can lead to a perforation of the cornea, you know, that transparent part of the eye that we use in seeing, and this may result into blindness in the child. Okay. So it's important that mothers don't put antimony powder in the eye of your child. It doesn't drive off any evil spirits, okay? It doesn't. And breast milk, seawater, engine oil, please don't instill them into the eyes of children, even adults. You see adults, or early morning urine, yes, early morning urine. Can you imagine? Somebody wakes up in the morning, that's early morning urine that is concentrated, filled with all sorts of bacteria.
Like, seriously?
Yes, seriously, and they put it in their eyes, that it makes the eyes to
I've heard of people drinking urine. I haven't heard that they put it in the eye.
No, they put it in the eye. They put the urine in the eye.
Oh,
and I've seen a patient, 2 or 3 patients, who had gone blind in both eyes because they applied the early morning urine. You know, how that leads to blindness is the urine is already contaminated because the man already has a gonococcal infection which he didn't know about. So he now peed, now put that urine in the eye. So you have gonococcal, yeah, you have.
Prof, please just hold it there. It's getting interesting, and would I really say interesting, frightening? Using urine in the eyes.
Yes, people put urine in their eyes.
Let's hear from our people out there if we have some people that actually know about putting urine in the eyes, the early morning urine. And also for mothers out there that usually will put this antimony powder on the eyes of their children. The reason why they do that is a myth, actually. We're back after the short break. Let's keep a date with the physicians. Stay tuned.
Healthy eye habits, that's like basically the things you do to keep your eyes healthy, to not reduce the quality of your eyesight and all that.
Like just like probably taking care of your eye and all of that. I don't know.
Those are the habits or the things you do to keep your eyes healthy, to protect your eyes from any defects to some extent, because there are some deviations in the eye which if you look at the mirror you could see, like when you are squinting, doing like this, So you could detect that yourself, like, you just feel like, oh, it's like at intervals my eye will just vibrate. Or you look at your eyes, you see that it's like there is a mark, it's swollen, it's reddened, it's like there is blood trace in the eye. So looking at it will help you for that.
Yes, my eyes is not paining me, so yes.
You can see a general doctor, a general physician, I mean, but the best person to see is a specialist.
See an eye technician or go to like an ENT.
Probably see an optician. I think that's what they call them, yeah? Optician, yeah.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We'll be talking about healthy eye habits to prevent visual disability. And in the studio with me, we have Professor Adeola Onakoya. She's a consultant ophthalmologist and also a professor at the College of Medicine, University of Lagos. She's talked so much about the care of the eyes, from washing with normal water, just normal water, and using the cotton to clean the eyes for children who have discharge, and also ensuring that these children, when they have allergy, you try as much as possible to discover the causative factor, what they're reacting to, so that you can take them off it. Then she also talked about the children. When you notice that they are rubbing their eyes often, there's likely to be an allergy, on the importance of also seeing their ophthalmologist. And she did mention, she talked about some adults actually using the first morning urine to put in their eyes. That is actually absurd. And of course, it led to some blindness because imagine some adults with gonorrhea putting that early morning urine in the eyes. Of course, that is straight blindness without treatment. Now we want to go back to Professor Onakoya. Let her tell us more about, at least we have been talking about children. Let her now tell us about the adults, how we can take off our eyes, the healthy habits, because we know the eyes actually are the gateway to the world. So, Prof, you've talked about these children. I don't want us to go back to those adults using urine in their eyes. That is really scary.
Yes,
so, from the eyes, actually, is it possible to know one who is healthy?
Yes, looking in the eyes, of course, you can pick up somebody who is ill. Particularly if we start from yellowing, you know, the white part of the eye, the color is white. But if you notice that in an individual, instead of it being white, it's off-white or yellow, that individual is actually suffering from like a liver disease. That yellowness of the eye is referred to as jaundice. So that person needs to see a doctor, needs to see a physician. So we can pick up jaundice from the eyes. And, you know, you see that commonly in people who have sickle cell disease sometimes, you know, because the reason why you have the yellowness of the eye, it's that membrane that I refer to as conjunctiva, you know, the vessel in it, you know, because you now have, you know, in sicklers, you have lysine, they lyse their red blood cells. The red blood cells, they keep lysine, they keep lysine. And so it then turns to yellow, you know, like you have the serum now flowing. So you see more of the yellowness on the conjunctiva. So they are, that's why they are jaundiced. Now, for people who are not sicklers, who don't have sickle cell disease, and you notice the yellow color on the conjunctiva, they should see the specialist, the physician, because it's an ominous sign of a liver disease, and they need to be attended to urgently. And another thing you may also see, sometimes you may see some white blotches, like foamy substances on the eye. You know, that may be a sign of vitamin deficiency, particularly vitamin A deficiency. We refer to it as bitter spots. You know, you just notice that the white part of the eye is dull, and then you notice like foamy substances on top of the eye. You know, such children need to be given vitamin A. Of course, they need to see the pediatrician, who will further advise as to what needs to be done. Then another thing also is if it looks so white, you know, you see some people, they look so white, which is referred to as them being pale. You know, you can actually assess whether one has enough blood running in the system just by looking in the eye. You know, looking in the eye, the sclera, you see that it's very white. And then if you pull down on the lower lid, you know, ideally the inside of the lower lid should be pink because there is blood flowing through. But if you pull it down and everything is white, then it means that individual is pale, needs blood, or does not have enough blood in the body. Or if it's yellow, then that person is jaundice. So that person needs to see the physician for proper attention. So just by looking in the eye, you can say whether somebody is well or not well. In fact, beyond just looking on the surface of the eye, we have an equipment called an ophthalmoscope, which we use in looking inside the eye. If we look inside the eye, we can tell whether somebody has diabetes, whether somebody has hypertension, even without measuring the blood pressure, because of the changes in the blood vessels that we have inside the eye, you know. And you can even tell if somebody is suffering from a kidney disease, you know, just by looking inside the eye. So that's why I said the eye is the window to the body, because it's like, you know, when you look through the window, you can see the environment. So looking through the eye, that is like the window, you can sort of view the body, you know, see what is happening in the body. So that's why we say the eye is the window to the body. You can tell if an individual is well or this individual is unwell, you know, just by looking inside there. There are so many other diseases that you can pick just by looking in the eye. You know, even on the surface of the eye, like somebody who keeps rubbing the eye, it may just be atopic disorder, you know, which happens all over the body, that you see rashes all over their body. So many other things that we can keep by looking in the eye.
Good. So talking about the health, we're still on the healthy eye habits that we need to do.
Yes.
I know growing up, we used to have this yeast that we put on our food.
Yes.
And I don't even know if it's still available now.
I still
So
see
what are the things, again, that people can do, like in terms of food, fruits, what kind of foods are healthy for the eyes?
Yes. Now, talking about healthy eye habits in terms of nutrition, the diet, what we consume. Now, the yeast you were talking about, I think is just some vitamin B complexes, you know. It's not really specific for the eyes, you know, but it's good for the body.
In secondary school.
In secondary school, you know, because it's delicious when you have it with rice. You put it on rice.
Oh,
very nice. I remember. Yes. Now, vegetables is good. Green vegetables, any green is good for the eyes, you know, because it has nitrites, and that nitrite is good for the eye. It helps in the health of the eye, particularly the nerves that we have inside the eye. And then the colored fruits that are in season, they are also good for the eyes.
Thank you so much, Prof. And nice having you again on the program, The Physicians. You have actually schooled us and told us a whole lot about the healthy habits. Any last word?
Yes. And the last word is, as we are getting older, talking about the elderly, the other healthy habit is you must ensure that you get your eyes examined. Once in 2 years. Once in 2 years. Once you are 35 years and above, make sure that you go and see the eye specialist, the ophthalmologist or the optometrist. They will examine your eyes. And the reason is, if you have glaucoma, that is the only way it can be detected, because glaucoma is a disease that is asymptomatic and it can result into blindness without you knowing. And by going routinely to see the doctor, you know, other disorders may be picked up. And so it's important that we go once every 2 years, once you are 35. However, if you have a family member who suffers from glaucoma or is blind, you also must go to have your eyes checked. And rather than go once every 2 years, it will be once a year for you, you know, so that you also do not go blind.
That is a very good point. You just nailed it. So thank you again, Prof, for coming on our program.
Pleasure.
I'm sure you've heard it from her. If you have a family member that has glaucoma, the eye check should be once in a year. That is yearly. But if you don't, as a routine, you should please check your eyes once in every 2 years. What else do you want me to tell you than everything that the Prof has just talked about? Eat fruits in season, green leafy vegetables. Do not fry them. Do not cook them for a long time. just parboil them, and it's very, very, very healthy. Again, I said, it's nice having you with us there. Always keeping a date with us on the Physicians Where Your Head Is Our Business. Till next time, stay blessed. My name is Dr. Martina Agberian.